So what does good treatment look like? Cognitive behavioral therapy is the evidence-based treatment of choice for BFRBs. And I've been talking about it. So we're looking at the behavior and in all aspects. And in this sense, we're looking at internal cues and reinforcing factors, which means we call it the ABC model, the antecedent, which is what happened just before, the behavior, which is the pulling or picking, and the consequence, which is what is the outcome, what happened just afterwards. And we want to really understand what's going on with this behavior, what makes it more likely to happen, and what reinforces it, so that we can change those things to reduce the likelihood that that behavior will happen, and also to get that need met in a different way. Which brings me to understanding the functional basis for the behavior and utilizing function-based interventions. We want this child to get those needs met. Like in the little bitty children, like the 20-month-old I saw yesterday is a thumb sucker and puts the hair around the thumb and then sucks. Doesn't eat the hair, but just uses that as a sensory piece of her pulling. And so we have to really understand that. And what we ended up finding was this amazing, soft, it's like a hairband that was super furry. And she immediately put it on her wrist. And then when she wanted to suck her thumb, she would take it off and rub it like this while she was sucking her thumb. And it was an amazing, and hopefully that's something that can help to get that need met for having something kind of rubbing that's soft on her face while she's sucking her thumb. Because we want her to get that need met of self-soothing and self-regulation. So there's excellent information and a list of trained therapists and treating BFRBs available on the Trichotillomania, the TLC Foundation for BFRBs website. It used to be called the Trichotillomania Learning Center. And sorry, that was way back 10 years ago. But now it's called the TLC Foundation. Their website is bfrb.org. They have amazing resources there. They have groups where parents can meet, groups where adults and kids can meet to meet other people who engage in BFRBs. And currently the TLC Foundation endorses the COMB model, or the comprehensive behavioral model, which is what I'm describing to you. And the book that they mentioned earlier is a clinical treatment guide based on the COMB manual. So what, as parents, can you do to help your child? And if you do nothing else, and if you hear nothing else from me today, hear compassion and understanding. So our job as parents is to help, right? And that's what we're supposed to do. And so it kind of makes sense that you see a behavior and you go, oh, we need to change that behavior. That doesn't look right. My child pulled half his hair out, or his eyebrows, or my child has picked a hole in his skin and it won't go away. It keeps happening. And so in the beginning, what we see as parents saying, hey, let's not do that anymore, very kindly. And then the behavior might stop, but then it restarts again. Wait, we talked about this. Don't do that. Stop it. And then the child might start hiding it, might start doing it outside of your awareness. And then you see, because you can see that it's still happening, well, wait, why is this still happening? I told you not to do that anymore. Then parents get frustrated. And because of all the myths and misconceptions that I mentioned earlier, parents can start to get scared. Did something happen to my child? Did somebody abuse my child? Is somebody going to think I abused my child? Is somebody going to think I'm a bad parent? And so we want to be very careful to remember that those myths and misconceptions are not accurate. So our job is to help, but let's talk about some ways that we can help. We can help by developing compassion and understanding. So help with BFRBs looks a little bit different. We want you to be the soft pillow. We want you to be the support, to be the person that's there to hold your child's emotion, to hold your child's struggle as they go through this journey, okay? And it's not to fix it. It's not to fix it. So sometimes help looks like saying nothing. And that's really hard for parents. And when I say say nothing, it means no side-eye glances, no dirty looks, no noises, no, I told you, no grabbing their hand and pulling it away. It is for many parents, the best thing is to say nothing. And I always ask, I ask I ask all my clients, what would be helpful for you? What would help? What would be helpful for your mom and dad to do? And what would feel supportive? And usually they don't say, I want my mom and dad to tell me to stop. So again, we have to be on the same team as our child. Helping does not mean fixing. Love unconditionally. Your child needs to hear, I love you no matter what. Because what can happen is if all the child hears is about hair, oh, look at her eyelashes are so cute. Or you look so pretty. Look at this picture of you when you were 4 and you had such pretty eyelashes. What your child hears is, well, I don't look pretty anymore. I must be ugly because I don't have any eyelashes. And that's why you have to be very careful when a child's going through treatment and doing better. Our instinct is to say, oh my gosh, it looks so good. Look how good you look with your eyelashes growing or your hair is growing out. And that's a really uncomfortable thing for a child to hear, because what they hear is, well, now I have to keep it this way, or I won't look pretty, or my mom won't be proud of me. My dad won't be proud of me. And so we kind of want to take hair and skin off of the table as discussion points. And in therapy, we really focus on engagement with whatever the treatment plan is that the therapist comes up with. Is the child engaged? Are they using their interventions, their strategies? Are they doing the things that we talk about doing? And if they are, that's all that matters. It's sort of like if I do my exercise and eat healthy, the weight's going to eventually come off. I don't have to weigh myself every day. So we focus on the behaviors that we can measure, and we focus on the things that we can see. And we don't focus on hair and skin. Resist the urge to police. And in our book, A Parent Guide to Hair Pulling Disorder, we talk about release, don't police. And it's resist the urge to micromanage the behavior. Resist the urge, unless your child asks you to. Mom, I really want you to tell me when I'm pulling or picking because I don't know when it's happening. That's great. If it's coming from your child, that's great. But most of the time that feels naggy, that feels negative, and that feels uncomfortable to kids. And, I talk to parents a lot. And one of the examples I give is, if I was about to eat a donut and my husband said, hey, don't eat that. That will make you fat. How does that make me feel? Does that make me feel like, oh, I don't want to eat the donut anymore? Thanks, honey. That makes me feel, thanks for letting me know that. Probably not. It probably makes me angry, frustrated, and makes me want to eat 3 donuts and pitch one at him. And thankfully, my husband doesn't say things like that, but it doesn't improve our motivation to change our behavior by telling someone not to do something in the moment that they really want to do it. And so a better thing might be a distraction. Hey, you want to go on a walk? Oh my goodness, I need your help in the kitchen. Will you come help me with this? If your child says it's okay to hand them a fidget, one that they've said would be helpful to them. Or a simple question, is there something I can do to help you right now? Those are much better ways to support your child than instructing them to do the thing that they already know they probably should do. Or it's out of what I see a lot is kids who are really unaware of it will say, I don't want my parents to say anything. Please don't say anything. And I ask them, please don't say anything for the next week. Well, the next week we come back, and if they followed that, oftentimes the child will say, yes, mom and dad didn't say anything. And I wish they would. I wish they would say, maybe a code word like, I don't know, supercalifragilisticexpialidocious, something that will remind me that I'm doing it. I need to stop. But now it's coming from the child. It's not coming from you. And it's a much healthier way to address it. Or I just want mom to give me a hug or hold my hand or just walk out of the room. So oftentimes we're working together as a team to figure out what feels like support, not policing and not nagging. And the other piece is focus on other aspects of your child. Focus on the flowers, all the most amazing things about your child and their strengths, their sports, their dance, their ability to play I don't know, Minecraft or whatever they like to do. That's what we want to focus on, or their kindness, their ability to be a good friend. And that's what we want to focus on, and take the focus off of hair and skin. Now, a lot of parents will say, but if we don't work on this, they're going to get teased. I'm just trying to help them not get teased. And of course, we don't want our children to get teased. But many of them will, and many of them will get teased for things other than hair pulling and skin picking. Most people will say they got teased at some point in their childhood. And because, 2 to 5% of people engaged in a BFRB, most of us weren't pulling our hair, picking our skin. So it's probably going to happen anyway. And a better approach would be to really prepare our child for, well, how would you handle that? If somebody did say something, what would you say back? Like, hey, why don't you have any eyelashes or eyebrows? Now we're talking about skills. And now we're arming them with some tools or ammunition to have something to say or to do. And there are a million right answers. And I always work with the child of what feels comfortable to them and what makes sense to them, and what they're willing to share. Some kids will say, I have trichotillomania, go look it up, knowing that most people can't spell that word in 4th grade. And so, and that can make other kids go, what? And not feel very smart. So, but some kids aren't comfortable with that sharing, and they just want to say, it's none of your business, or, whatever, and find a way to escape that without internalizing it and feeling negatively about it. And that's really the biggest risk, as when you think about being a parent. What do you want for your child? What do you want your child? What do you want the outcome of all your parenting effort to be? And usually what I hear when in response to that question is, I want my child to like themselves and to be a responsible human who, is able to take care of themselves and is a kind person. And so when we reframe it, we see that focusing on hair pulling and skin picking probably isn't going to get us there. And what we want our child to know is that we love them no matter what. No matter what, hair, no hair, it doesn't matter. They're still an amazing human being. Okay, so I really want you to remember that. And sometimes it takes just reminding yourself every day of all the cool things about your child, everything that they do that's amazing, or anything they do that's amazing. Sometimes children are at that challenging age and it's harder to identify those things. And then they go into an age that's easier. So love your child unconditionally and tell them so. Honey, I don't care if you have hair or not. Hair does not make you a special person. There are plenty, believe me, I see plenty of people with lots and lots of hair that are not happy. Because I treat people with all kinds of different psychological problems. I also see people that have a lack of hair for one reason or another. Sometimes they pull it. Sometimes they just have thinning hair or male pattern baldness, and they're extremely happy people. And so hair does not equal happiness. So we have to be careful not to fall into that thinking trap. Ask your child what he or she needs from you to help them feel supported and loved. Ask them, right? That's a better use of your time talking about BFRBs than nagging or reminding or throwing strategies at them.